Well, we're live and welcome to the 7 o'clock talk. And tonight, Nurse Jess and I are going to go over three questions that we've gotten. I posted something in the social media groups and I received three requests. One was on PCOS, one was on uh, chemo, and the last one was on catecholamines. So let's cover chemo first. And where's your mic? Because they're not going to hear you. Here it is. There we are. So I guess kind of explain what chemo is for and what it does.
I mean, the gist of it, I sound horrible just
Here we go. Got a phone call. So chemo is,
it's used to kill cancers in the body.
and is it specific?
Depends on the chemo. So can be and can't be. Depends on what it is. But I think you asked if it was toxic. Absolutely, it's toxic. So I can only speak from the nursing side from handling it, because I don't really have any like daily basis experience. But when I had to deliver it, it actually gets delivered in a black box with a nurse with double chemical gloves, and then she has to wear a face mask. I had to wear a face mask. I had to wear double glove chemical gloves.
Libby.
And then you have to make sure they swallow it, and then you have to take and discard all of that, because we even have to wear gowns, and then we have to discard all of that in a special trash bag. And you have to take that trash bag back down to the pharmacy, still wearing your special gloves. So I would say that's pretty toxic, and they can't open the bottles or mix anything unless it's under a special hood.
So as a chiropractor, primarily, that trained as a chiropractor, I can't prescribe. I can't tell people to do chemo, not to do chemo. I can, however, say that in reading, if you look at Dr. Walter Longo and any of the cancer research, chemo is effective. It kills a lot of stuff, but that's what it's designed to do. It's basically, if you listen to Dr. Peter Attia, who at first was a chemo, hi Kathy, who first was a cancer doctor. Chemo is designed to kill everything, and they just kind of hope that you come back before the cancer does. So it is very cytotoxic. Now, Dr. Walter Longo, who does a lot of studying on fasting, what? Let's back up just a step. Chemo kills everything. That's what it's supposed to do. You want the cancer.
It can, depending on the drugs. So we can't just blanket statement and say chemo kills everything, because that's not true in some instances. Because some of the new drugs are very specific as to what it kills. But generally, the old school, or if they don't know what type, they use a broad, and it kills a lot of things.
So the new types of drugs that she is alluding to are ones that work with your immune system, and I'm going to get to that. And so what I will say is in Dr. Walter Longo's work, when he was looking at the old school clear cutting chemo, if a patient was to actually go against their doctor's wishes, because the doctors want you to eat, they want you to be robust and healthy and have a lot of calories on board so you can survive this. But what they found in research was that people who fasted for 72 hours before they got their chemo, it became chemoprotective. So the cells would actually kind of go into a hibernation. They called it a shell.
Well, and and the sugars in your food actually feed cancers. So you, by eliminating your sugars, you're actually starving them.
You're starving the cancer cell, so then the cancer cell is taking up everything that it can, and it will get the chemo faster. So it spared the healthy cells, and it starved out the cancer cells. Now, the new types of chemo are T cells. They're based on T cells, I believe. And it's fascinating work. But at first, it was a flip of the coin as to whether or not these things were going to work. And they started to figure out, or they wanted to figure out why. Why did it work in some people and it didn't work in others? And when they did the research, they found that it dealt with the patient's microbiome, and especially with a bug that you've heard me talk about called Akkermansia muciniphila. And so if a patient did not have that bug on board, then what happened to them is they that chemo didn't work as well in them, or didn't work at all. And then if they used and I'm trying to remember what that chemo is called, but then if Akkermansia was on board, then the patient's own immune system tagged the cancer cells, and it did what it was supposed to do, eliminated the cancer cells. So it is an absolutely fascinating field of chemotherapy where they are actually trying to help our own innate cells kill the cancer cells because they kill it best. And they, to Jess's point, they are highly targeted because then you're not losing your own cells. But it's newer, and like I said, I don't know a lot about that.
Well, and they also have chemo now that are seeds, so they actually implant them directly into the tumor, into the core of the tumor, and then it only.
Well, the radioactive seeds, right?
Yeah, and they only kill, hopefully, the tumor.
So, but when you do that, the patients that I've had that have had that, they can't be around anybody. They can't be around anybody's.
Well, actually, that's all chemo. Actually, all chemo. You shouldn't be around any little kids or animals, and like you have to clean up after yourself and flush the toilet twice, and you are actually active where you're shedding radioactivity for a certain amount of time, depending on what drug you're taking.
So it's very, very important to have yourself set up.
A lot of times, people that have thyroid cancers, they actually have to move into a hotel while they get their treatment because they actually can't be around their family. It actually creates a hazard for them.
So in any instance, it's very important for you or for the patient to have their nutrition on point. Recently been doing a lot of reading. There have been several books and several studies that have come out about uric acid and how uric acid is one of the leading indicators of cardiovascular disease, and how it's a leading indicator for cancers, and it's a leading indicator for heart attacks and strokes and high blood pressure and gout and all of this stuff. And what does uric acid, what triggers uric acid? I know you know the answer because you've heard me talking about it. But the number one culprit is fructose. And so everybody, Peter Attia had a researcher on. Dr. Perlmutter just wrote a book called Drop Acid. And then Dr. Hyman had another researcher on, Dr. Johnson. And they all talked about fructose. So it's very interesting. If you eat a piece of fruit, one piece of fruit, say an apple, which has a lot of fructose in it, only has about 8 grams of fructose in it. So that can't overwhelm your system.
Well, and it also has a bunch of fiber.
And that helps slow the release of the sugar into the system. But if you're eating a smoothie And I was making this mistake and I've stopped. But if you're having a smoothie and you're putting apples and blueberries and a banana in there, you're now up to about 24, 25, up to 30 grams of fructose. And that can overwhelm your GI tract and let the fructose spill into the liver, which causes fatty liver and a lot of other issues. So, even with fruit, if you're going to eat fruit, eat a piece or two of fruit. Eat an apple or eat an apple and a banana. But I have since started to back off on my suggestion to help people get a lot of colors into their diet. I've told them to, just make a smoothie and throw cherries and blueberries
Well,
and
I guess you could
raspberries.
throw a bunch of different ones. You just have to be sparing about each one of them.
Yeah, I
Instead of eating 3 pieces of fruit in one smoothie, eat a part of a piece of fruit.
what I personally am doing now is I put blueberries in there, and I'll put my collagen, and I'll put my Ultra GI Replenish in there, and that's what I have been doing. And I can already tell, with having done this a week, the difference. And so fructose goes hand in hand with insulin because it shuts off the check limiter. And how this ties into chemo and cancer is insulin is a pro-growth hormone. Insulin is an anabolic hormone, and it causes things to grow. So once again, if you're getting too much of these things, then you're having a problem. So what should somebody who is having cancer and issues and stuff like that, first off, talk to a cancer nutritionist. Talk to a nutritionist that specializes in cancer, because they're going to have you eating like broccoli sprouts, and they're going to have you eating a lot of things with sulforaphane and with sulfur bearing types of vegetables, because that helps your own detox system work better. But this is all just to set you up so that you can go through it and live through it and come back better and hopefully cancer free. But, once again, to my first point is I can't prescribe drugs, and I am not a cancer specialist. I am relaying what I have read from those who are cancer specialists. So hopefully that covers your question. The next question, since Miss Kathy's on here, they were talking about, we got a call or a text asking about catecholamines and asking about AFib and exercise. And so, can you explain what catecholamines are?
I don't remember at the moment.
So, catecholamines there are two parts. One part is the amine group that goes along with it. But what the specific question is, what is a supplement that can help control the catecholamines that cause AFib during exercise? So this is a multifaceted question. And the first part of this question, that how I would answer it is anybody that hasn't been exercising should go into exercise very, very slow. And the reason why I say that is because if you haven't exercised and you do something stupid and you go hit it hard,
Oh, you're going to be so sore. You're going to not want to go back and do it again.
number one. And number two, when you have that soreness and that pain, then those are proteins that are breaking down. That's where you've broken muscle down. And depending on how well you clear things. So the things that clear catecholamines are monoamine oxidases, MOAs, or MAOs. Those are what clear it. And so there really isn't a supplement for that per se, but what there are enzymes that people can use. And so if you use a very well-rounded protease enzyme, um, it helps with a lot of things. So, personal anecdotal story, I'm 52. I haven't run in 4 or 5 years. 2 weeks ago, I ran a mile point 3 to the nursing home, saw my patients, and I walked back. And this poor woman, she is a saint. She listened to me whine and cry about how bad my legs hurt all week. I expected a day or two, but it hit me for 4 days, and I didn't run hard. It was a 10-minute mile. Mile point 3 took me just over 10 minutes. And so immediately I know that I'm not clearing the histamines out of my system, which cause so the Aura ring tells me I'm not recovered. My heart rate's off. Things, what happened. And so I know it's the exercise. I started taking the protease enzymes 2 weeks ago. I take 2 protease 3 times a day on an empty stomach. And what that does is that has loaded my system now with these proteolytic enzymes, and that's their job. Their job is to be into the bloodstream, and it's to clear out partial proteins that cause problems. So if someone is going to get back into exercising until their body gets acclimated to it, and I'll probably take those protease enzymes now for the next couple of weeks, but I can tell you right now, I went back to exercising this week, and we've basically been doing 2-a-days. And so we do a stretching with a muscular warm up, and I did a bunch of squats, and then I rode my bicycle. And upon doing all of that, a little tightness, nowhere near what I had before. Heart rate looks great. So you can start to look for monoamine MOAs, or you can start to just take a very broad spectrum proteolytic enzyme, and that will help relieve any of the muscle damage that releases those cytokines really into the bloodstream. It'll help clear those out, and it helps with the pain. Another anecdotal story is, I don't remember how old I was. I was in my 20s, and I had all 4 of my wisdom teeth cut out. My Metagenics rep, Andy Robbins, said, hey, if you're going to go in for surgery, take these proteolytic enzymes before you go into surgery, and it'll help you not be as much in pain, not have to, your recovery time will be faster, and you'll be set. So I took those. I took them for 3 days before the surgery, and then I kept taking them after the surgery. Had all 4 cut out. Evidently, I had some weird structure with bulbs, and they had to bust stuff up, so they got kind of rough with me. I did not bruise. And then when I went in for my checkup, I had ripped all 4 sets of stitches. The plugs were all gone, and the doctor told me I had dry socket. I didn't hurt at all. I didn't even take the first pain pill. They gave me a half or a quarter of a Valium. No, I went under general for that. They gave me a half or a quarter when I had my eyes done. When they did surgery on my eyes, that wiped me out forever. A quarter of a Valium took me out for like 16 or 18 hours. But the proteolytic enzymes are what I attribute that to. And then Metagenics quit making them. And so now we found a new source called Transformation Enzymes. And if you're interested, yell at me and I'll get you the information so you can order those. Proteolytic enzymes are cheap too. I mean, they're plant-based. They grow them on mushrooms actually, and they do a fabulous job with pain. So that's question number 2. Question number 3. We have talked about this and talked about this and talked about this. This is one of her absolute passions, and it is female hormones, and it's PCOS. So PCOS stands for polycystic ovarian syndrome. There are some great blood tests that you can do to start to see what is causing that, and you can also take your blood and look at the hormones. So what kind of, this person actually asked, what's the best diet for PCOS?
Well, I mean, that's individualized really, but you want to eat a good balanced diet with lots of fruits and vegetables. Your phytoestrogens come from a lot of your vegetables. You want to eliminate your sugar in all your sensitivity triggers. But polycystic ovarian syndrome really is driven by your diet. You want to make sure you get good fats so that you can make the cholesterol so you can make your hormones. Get your exercise, drink your water, eliminate your caffeine, the sodas, like all that.
From the laboratory standpoint on my end, we start right off the bat with eliminating all sugar sweetened beverages. We also, somebody's jamming. We eliminate all sugar sweetened beverages. We get rid of fruit juice because, once again, that goes back to uric acid, and that goes to insulin, and that goes to oxidation of the hormones. Your regular sugars, if you're eating candy bars and you're eating crappy chocolate and whatnot, that all goes down that pathway of taking insulin and boosting insulin, and that oxidizes your fats. And then if you're eating a standard American diet or typical American diet, the problem is you're not getting enough fiber. So you have to have about 40 grams of fiber to bind to the old estrogen and get it out. You also have to make sure that you're getting enough of the precursors, to her point, the good fats, so nuts and seeds and avocados and olive oil and avocado oil and all of that stuff, so that your body has what it needs to make the hormones. For women, you have to make sure that you have enough of the pregnenolone, you have to have enough of the progesterone, you have to have enough testosterone, because testosterone directly goes to estrogen in women. And so those types of things are foods. When you look at foods for that, you want, red meat once to twice a week tops. You want to be getting good sources of omega 3s. You want to have lots of, if you listen to the first part of this, which was about the chemo, you want lots of the brassica vegetables. You want Brussels sprouts and broccoli, and actually you want broccoli sprouts. They've got a lot more sulforaphane in them. But those are the things that you want in your diet regularly. Now, if you're having problems with PCOS, you've got to identify that. Get a uric acid test, get a fasting insulin test.
Uric acid also, if you're having problems with that, that's driven a lot by alcohol and red meat.
Well, in alcohol, if you sit back and think about this stuff, it's pretty simple. Alcohol's fructose. It is fructose that has an OL on the end of it. I mean, we make methanol and everything else, but that comes from that fruit sugar. So, fructose, if we were back in the Stone Age, I'm going to have a little aside. So that's the PCOS. We're going to have a bonus here for a second. Fructase, which is the enzyme that's in us that takes fructose and converts it into basically fat, a storage unit, a storage mechanism, is a beautifully designed system. So I believe in God, and if you don't believe in God or a being, you have whatever is your higher power, whatever organized us that you think, whatever that is, designed a very elegant system to help you survive. And fructose is to get you through the lean times. Fructose goes into the body, slows the mitochondria down. So I may eliminate fruit quite a bit because right now I'm dealing with a little long haul COVID stuff, and I don't need fructose in my system slowing my mitochondria down. But it slows the mitochondria down. It raises insulin. It raises uric acid. And it tells your body to pack on fat because there's not enough food around. So it is very, very, very important to absolutely not be drinking this stuff. So high fructose corn syrup, fructose, corn syrup, fruit sugar, crystallized fruit, whatever you, that's all fructose. They have, you know, put lipstick on a pig and tried to pass it off for a beauty queen, whatever the analogy is. I don't know. I just butchered it. But that is absolutely, there are three things that sell in America: fat, salt, and sugar. And sugar by far is one of the biggest things. But that all leads into all of these things. PCOS has been seen for decades, but it used to only be seen in the ultra wealthy and those people who could get a hold of pre-prepared and packaged foods. They were called the diseases of the wealthy or diseases of modernity or whatever. And those are the things that get us. And it's, you know, I don't want to give up conveniences, but I do read packages. And if I see any of the euphemisms for fructose on there, I don't buy it.
But we very, very rarely ever buy packaged food.
Well, I mean, we bought cauliflower crusts, but there's no fructose
yeah,
and
I mean,
stuff.
but minimal.
Yeah, I mean, if you come to eat at our house, typically we've picked it, cut it up, and served it. And you know that's your best diet for PCOS. Now, with that being said, how much damage have you done to yourself? Because you may have to do. Let's go back to the God analogy. You may have to do a little penance to get your system back online and fixed back up. But
And hormones are tricky. Like
oh
that
God,
takes. I mean, we're not talking about days or weeks. It's going to be months and months and months before you can regulate your hormones. But you have to also be very careful about your exercise because too much exercise can actually create the problem you're trying to fix. So everything that I've read is low impact and walking. If you don't know, walking is the absolute best way to help balance your hormones.
Yep, very low impact exercise.
Stretching,
Yoga,
and walking, yoga, things like that. Like if you don't need to go out there and CrossFit or like just really hammer your body because you actually create cortisol spikes, which actually mimics the problem you're trying to fix and actually compounds it.
Yes.
So you make it worse.
So she hit the nail on the head with high intensity interval training spikes your cortisol, which will spike your blood sugar, which can spike your insulin. And insulin, once again, is one of those oxidizing agents that causes issues. So I know this was a little bit longer, but we love to get questions and we love to go into those questions. If you have any of the problems, well, we don't deal with chemo and cancer, but if you have PCOS, if you have any of these other things, it's really smart. And we've had everybody around us that is ill. Granny's done all three tests. We've done all three tests. We're actually getting ready to start doing telomere testing. We'll talk about that here in a second. But with all of that, it lets you see where the holes in your health are.
We'll actually probably talk about telomeres next week because that's pretty lengthy. and pretty fascinating.
Yep. So telomeres next week. Our tests actually should be in tomorrow. So we're going to get our telomeres tested and see what our biological age is as compared to our chronological age. We'll see you then.